Over the past months, we have witnessed, in the starkest terms, the ongoing devastating effects of racial and ethnic inequities that are woven into the fabric of our nation. First, the coronavirus pandemic laid bare how Black and Brown communities bear the brunt of the disease. Then, George Floyd's last words, "I can't breathe," quite literally exposed the pervasiveness and toxicity of individual and structural racism that is suffocating communities of color. Over the past years, CPQCC research has shown that NICUs are not immune from racism. We do not practice in a social cocoon. As neonatal healthcare providers, we must act for change. Black and Hispanic infants are more likely to receive care in low-performing, under-resourced hospitals, where in turn they are more likely to be infected and die. Within NICUs, Black and Hispanic infants and families are victims of racially motivated neglect and judgmental care. The legacy of racism is strong. Yet in these dark times, I also see light and progress. The uproar over what happened to George Floyd, Breonna Taylor, and Ahmaud Arbery is being felt by vast numbers of people of all stripes and colors, and by many of us who work in healthcare. Many of you already have joined efforts to root out racism in the NICU. At the CPQCC, we have tried to provide a platform for change. As an action and data-oriented organization, we have elevated the Health Equity Dashboard, which you can see behind me. It is now the first page you will encounter when you log onto your CPQCC reports, and I encourage you to take a thorough look at it and ask yourself whether there are opportunities for health equity. In addition, our Health Equity Task Force is moving to address both structural and individual racism. Please join this effort and invite others to do so as well. I firmly believe that CPQCC, with your expertise, enthusiasm, and dedication, will be at the forefront of reducing racial inequities in the NICU. And I want to thank you from the bottom of my heart for your engagement.